When I was about 3 months out from PT school, basically, I started my career in the Army, and I was active duty and, stationed at Fort Sill, Oklahoma. And I was the first clinic that I went to was a traditional clinic setup. So the therapists each had their own individual office sort of evaluation space. And then there was a big open gym where a lot of like the treatments and PTA appointments would happen. And I spent about 2 months there. And then my boss moved me over to what we call the Soldier Centered Medical Home. And the Soldier Centered Medical Home was comprised of a team of primary care providers, a couple of physicians, a bunch of PAs, I think some NPs as well. And then there was a group of LPNs and medics. So medics are basically like active duty, kind of like active duty MAs, LPNs, depending on like the training is not the same as the civilian sector. But anyway, so support staff and triage individuals. And so I was with these primary care providers. I was the physical therapist, and then we also had a behavioral health professional in our space. And any other services like lab, radiology, pharmacy was very in a close proximity. So when a patient had a neuromusculoskeletal complaint, they could come and see me directly. They could, if they had a couple of complaints, they could go and see their PA or physician. And then if their PA physician was like, okay, they have a cold, they have a blister, I'll take care of those things. And they also have ankle pain. Then they would just kind of send that patient over to my office. And if I had a patient, I would just tell them to wait for a few minutes, or I would get them on my schedule at some point throughout that day or the following day. So I grew up in this model, and it was awesome because I got to see what the primary care providers were doing and what their training and their skill was. We got to form a really nice partnership with one another. Whenever I saw something that I didn't believe was musculoskeletal, I could literally go right across the hallway and tell their primary care about it. They could address it on the spot. It was a much better, I was the most satisfied I've ever been as a provider. And I think probably my peers, my non-PT peers would agree with that for the most part. And same thing for the patients. I mean, I think it's kind of like a one-stop shop for what your needs are. If I had a patient that expressed a behavioral health need, I could walk them right over to the behavioral health counselor and make sure that their needs were met, instead of like referring them and then hoping the patient follows up on it and all that. So I grew up in this model. And then when I transitioned into the civilian sector, my first job out of the Army was at the University of Oklahoma's Cancer Center. And while PT did have its own clinic, there was this multidisciplinary mindset. So if a patient with breast cancer was newly diagnosed, every week, the breast team would meet and they called them tumor boards. It's a name.
Yeah.
But it was a meeting about all of the new cases that came in with breast cancer that week, what the plan of care was going to be, what their needs were. And it was like the radiation oncologist, the surgeon, the medical oncologist, PT was there. Sometimes SLP was there, depending on like if it was a head or neck cancer, the psychologist. So there was a lot of great multidisciplinary stuff happening there as well. I then transitioned into a kind of a multidisciplinary private practice where it was a sports medicine physician, a family medicine nurse practitioner, and then me as the PT. Great setup. Also totally, that was like on a fee for service model, but we still were co-located. So there was really good communication and collaboration between the three of us. Transition into the like sort of traditional corporate PT, not the same. And I was very disappointed by it, just the way that it worked. And that's where I felt that I was in the middle of a regression in our fields, where like they really were relying on referrals, not going direct to consumer exactly, and like, wanting to do everything explicitly as the script stated. And it just didn't work out.